share.
We're going to go ahead and get started with our next panel, everyone. So our next panel is called Preventing Prevention, Contraception, Sex Ed, and the Politics of Youth Health. This panel will explore how laws and policies that govern restrictions on contraception access, sex education, and reproductive health infrastructure shape young people's reproductive lives long before pregnancy occurs. We will discuss abstinence-only education materials, consent and confidentiality barriers, and the cascading effects of Planned Parenthood closures on youth access to preventative care. I'm going to go ahead and introduce our wonderful speakers. First, we have Mitra Medizadeh. Mitra is a senior staff attorney at the Center for Reproductive Rights, where she has led cases in state and federal court to protect and expand access to reproductive health care. Prior to joining the Center, Mitra was an agency attorney at the New York City Commission on Human Rights, where she enforced the city's anti-discrimination law with a focus on claims of gender discrimination and gender-based harassment. Previously, Mitra worked on impact litigation involving children in state custody as a staff attorney at Children's Rights. Mitra is a graduate of Harvard Law School and the University of Chicago. Next, we have Lauren Lava. Lauren is a reproductive rights leader, orator, and policy advocate who has a decade and a half of experience advancing reproductive freedom in Ohio. She is the first executive director of Planned Parenthood Advocates of Ohio after gaining productive experience as an intern, organizer, field director, and vice president of government affairs and public advocacy. Lauren, through her work with Planned Parenthood, has organized against every abortion ban and restriction, promoted healthcare policy, and campaigned in every election cycle in Ohio since 2010. In 2023, Lauren led the coalition as co-chair of Ohioans United for Reproductive Rights, the campaign that passed the Ohio Reproductive Freedom Amendment with 57% of the vote. And Lauren was named Time's 100 Most Influential People in the World in 2024, honoring her leadership and historic effort by the coalition partners and voters. Next, we have Lucy Arbayo. Lucy currently serves as the executive director of Jane's Due Process. She is the proud granddaughter of Mexican immigrants and was born and raised in Austin, Texas. She received her bachelor's degree from St. Edward's University and graduated cum laude with a Juris Doctorate from St. Mary's University School of Law. Lucy was placed as If When How Reproductive Justice Legal Fellow after graduating and most recently worked at the National Latina Institute for Reproductive Justice, leading the Immigrant Access to Healthcare and Coverage portfolio. Lucy is also an abortion storyteller and board member for ARC Southeast, an organization that provides funding and logistical support to ensure Southerners receive safe and compassionate reproductive care, including abortion services. And finally, we have Allison Macklin. Allison has an MSW is the Director of Public Affairs at SECUS, Sex Ed for Social Change, providing strategic guidance to communities looking to advance sex education, and is a national leader in the comprehensive sex education field since 2004. In 2019, she helped author and pass Colorado's Youth Wellness Act, ensuring young people in the state are able to access inclusive, comprehensive sex education. Allison is the author of the internationally published Making Sense of It All, a guide to sex for teens and their parents too, and a skilled sex education trainer. So we're going to go ahead and start off with Mitra giving a little explanation of her work.
Thank you for the intro, and thank you so much to everyone for having me here. It's a pleasure to be here with you all to be talking about this topic. So I'm going to talk a little bit today about some of the work that I've done of late related to protecting public funding for contraception and other sexual and reproductive health care. And I guess first, just to step back a second and say, why are we talking about public funding in a panel on youth rights? So public funding like the Title X program, which I think one of my co-panelists is going to discuss further, and Medicaid have been really essential to allowing a broader group of the population to access sexual and reproductive health care. And in particular, programs like Title X have been important for building a network of health centers that can focus on providing this care. And so many organizations, there's some of the clinics that specialize in providing family planning services, have been doing this for years or even decades, and so they have built a reputation of trust. And in particular, with communities who may be worried about confidentiality, including young people, as well as rural patients who may worry about their community knowing their sexual and reproductive health history, going to a clinic that specializes in providing this care and where they can be confident that information they share will be kept confidential is hugely important in making people feel comfortable in sharing their personal information with the healthcare provider so that they can get the healthcare that's right for them. And so Medicaid in particular provides coverage for a number of family planning services like contraception, cancer screenings, STI testing and treatment, as well as preventive care. Federal Medicaid dollars do not pay for abortions outside of extremely limited exceptions, and that has been the case for decades. So as part of the One Big Beautiful Bill Act that was passed last summer, there is a provision that excludes certain healthcare providers from being able to bill or to receive federal Medicaid reimbursements. And the healthcare providers that are considered prohibited entities under that law include those that are nonprofit, essential community providers who specialize in providing reproductive health care, that provide abortions, and that received more than $800,000 in Medicaid reimbursements in federal fiscal year 2023. And if you look at who actually meets those criteria, as well as looking at the legislative history and what various people have said about this law, as well as previous versions of the law that have been introduced, it's pretty clear that this was an attempt to target Planned Parenthood specifically. But it does also affect a couple other providers, including one of our clients at the Center for Reproductive Rights, and that client is Maine Family Planning. So Maine Family Planning operates a network of 18 clinics in the state of Maine that provide the full scope of sexual and reproductive health care. Until last fall, they also provided primary care at 3 of those clinics. Maine is one of the most rural states in the country, and so many of the clinics that they operate are in areas where there are significant provider shortages, and in particular where there are shortages of providers who accept Medicaid. Almost half of their patients who receive care other than abortion care are enrolled in Medicaid, and Medicaid reimbursements until last year when this bill took effect made up nearly 25% of their annual budget. And so the loss of the ability to bill Medicaid really threatens their ability to continue serving patients, not just to, it threatens their ability to continue serving all patients. And while this bill may have been an attempt to target Planned Parenthood, and while it was specifically directed at the provision of abortion, it has had an effect on a lot of non-abortion care because the Medicaid reimbursements that are being held under the law are for non-abortion care, including contraception. So we sued in federal district court and challenged the law under the Fifth Amendment's equal protection guarantee. Equal protection basically means that when the government treats people differently, or rather it means the government should treat similar entities or people similarly unless there is a reason to treat them differently. And that needs to be a legitimate governmental reason. It can't be based on animus or dislike for a particular group, which here the legislative history of the law showed that this was. So unfortunately, we did not obtain preliminary relief, block the law, and we ultimately dismissed that case in December, which means that the law remains in effect. And so for Maine Family Planning specifically, that's meant that they had to close their primary care practice because without the ability to bill Medicaid for that care, continuing to see primary care patients wasn't financially feasible. So they did that in October. It's also had, or there has been some reduction in the number of patients they've been able to provide contraception to during the time that this law has been in effect, specifically as compared to the same time period in 2024. In the last 6 months of last year, the distribution rate for emergency conception was down by 10%. Oral contraceptive distribution rates fell by 27%, and IUD insertion rates were down by 10%. So we are seeing some effects and some fallout from that. And this is part of a broader attack on public funding for family planning through other programs as well. But it's long term, what this means is it threatens the ability of these clinics that have been an essential part of the reproductive healthcare infrastructure to continue serving patients. If they close, some patients may have nowhere else to go, particularly in rural patients and for patients who do rely on things like Medicaid or other publicly funded programs to be able to access care. There's also a risk of a domino effect on the rest of the healthcare system because if patients lose access to one provider, they may try to go to another provider, and then there will be more delays for everyone. So it is really a direct threat to a broader public health infrastructure.
Yes, it is. Thank you, Mitra. I'm going to dive in a little bit more specifically with what we are seeing in Ohio with Planned Parenthood. Planned Parenthood was the provider targeted and impacted in Ohio. Just to give some context for the healthcare crisis that we're in now, I call it the big terrible bill. It's just it's been so awful, and yet so effective. Before that bill went into effect, here in Ohio, we have had over a decade of defunding and financial impact that was already impacting access to reproductive health care. And that, was both at Planned Parenthood, but certainly we've seen our entire state's infrastructure around healthcare be in a really downward spiral. And it is all political, but I understand this not the conference we are currently at, but there are connections that we can make there. But just some things to highlight before I go to my for the next slide is that Planned Parenthood in Ohio was defunded. The law was passed in 2015. I think it went into effect in 2019 because we did litigate, but we lost that litigation. And what that means is that the Ohio Department of Health cannot re-grant any funds to Planned Parenthood, specifically because we're an abortion provider. And in the same year as 2019, with Trump's first presidency, we were forced to leave the Title X program, which I'll explain more next. And so it was like we got defunded twice at like both the state level and the federal level when for our ability to provide that affordable family planning. So again, that contraception, access to sexually transmitted infection testing and treatment, cancer screenings, all of this like family planning, preventative healthcare. And that's actually what Title X is for. So Title X is the only federal grant funding for family planning. It was created under the Nixon administration, so it's been several decades. It used to not be political or it was nonpartisan. The idea that if people were able to make their own preventative health care on their own, that would actually prevent abortion. I'm not sitting here saying we need getting an abortion is an affirming healthcare choice. And also all of our folks should have access to all the information and access to preventative care that they need. And so defunding Planned Parenthood is directly impacting our patients. So it's very political. It sounds like a political attack on Planned Parenthood, but it is a direct attack on our patients and on the communities that we serve. So we were already defunded when President Biden came into office. We were able to re-enter the Title X program, which allowed us to provide the sliding fee scale. So the important thing about Title X is that any healthcare center that has Title X, including Planned Parenthood, it's what allows us to have free healthcare for some folks. Or based on your income, there's a sliding fee scale for how much your healthcare will cost. So it's really important. So when folks could go to Planned Parenthood and it be free, it would be because we had Title X or because our patient had Medicaid. And here in Ohio, we had Medicaid expansion. So around 2014, 2015, as part of the Affordable Care Act, states had the opportunity to increase access to Medicaid. So before that, being able to access Medicaid usually was because you were low income, but also you had a disability or you were pregnant. But not after you were pregnant or before you were pregnant. So the Medicaid expansion made Medicaid accessible based on your income, which was also really great access for many, many of our patients. So in context, for the last decade, Planned Parenthood's patients who were using Medicaid really increased. So we were serving a lot, about 40% of our patients had Medicaid. So usually what we would do if you came in and you qualified for zero, we would try to help you get on Medicaid, which helped, be served at Planned Parenthood, but also at any healthcare provider. And it's also part of the terrible bill that Medicaid expansion is likely to go away for most Ohioans. It's already starting to happen, but it will completely be in effect by 2027, which was also political. About they chose to have that impact happen after the midterms. So my next slide is this is before the terrible bill goes into effect. So Planned Parenthood across the state was serving over 87,000 patients. There were 21 brick and mortar Planned Parenthood health centers, and we were trying to expand telemedicine access. So this was, again, like being able to cover Medicaid, having Title X for a couple of years, but was already like, if I was showing you a map from a decade ago, there were many more health centers that we had throughout the state because the defunding from the state really had an impact. And then, of course, the loss of Title X during the first Trump administration. I said a lot to say that like we've been under attack for a long time, and it's having a lot of impact that was really exacerbated last July when the terrible bill went into place. So this next slide is where we are now. So we have 17 brick and mortar health centers. That means we had to close 5 physical health centers, and 22,000 patients were using Medicaid. And basically overnight, they weren't able to access their provider of choice that they would normally have been. And for Planned Parenthood of Greater Ohio that I represent, which is about a little over 3/4 of the state, we lost $10 million, $8 million of which is from Medicaid, and $2 million is from Title X, which we also lost again under the second Trump administration. The difference for Title X, to give more context, is in the first Trump administration, we had to leave because he put in a domestic gag rule. So he said like you couldn't talk about abortion. That's core to our mission, our values, talking to people who are pregnant. And so we were forced out of the program that way. In his second administration, we received collectively around Planned Parenthood, and I'm giving more detail than I normally do because I know that it's how we all function here, but what I was going to say. Anyway, the Title X, we lost it this time because they said we were doing DEI programming, and we just got a letter. We didn't have a choice. They were just like, you're not getting money. So several of us challenged, and the court system was helpful in that they were like, okay, well, we didn't get an injunction, but they said the government had to hold on to the money. And so we got a letter a couple of months ago saying we could now pull down the money. So it wasn't like necessarily a win, but it was like they stopped fighting it and we got our money back. And we saw a huge spike in our patient volume. So the fact that we hadn't been able to cover most people for free, it impacts access to like IUDs. It's nope, say it right. Yeah, IUDs. It's been one of those days. So they're expensive, and not having Title X, not having access to Medicaid, like we aren't able to cover that cost for our patients, especially because we're like a decade into these attacks, so we're not that financially sustainable as an organization to like cover the cost anymore. So it has had a significant impact. So those LARCs, or long-acting reversible contraception, which is often the easiest, like kind of set it and forget it birth control that you can reverse, but it's often the birth control that we want young people to have access to, all people to have access to. It's the most expensive, and we're the most impacted by losing Medicaid and losing Title X, because Title X also, there's something called 340B pricing. It's how you can, as a like community provider, get low cost birth control, so you can buy in bulk and pass that savings on to your patients. You have to qualify in certain ways, and the only way Planned Parenthood qualified was from having Title X. So not having Title X, we also lost access through the 40B pricing and had more expensive birth control. So then we were covering those costs too. So it's the impacts, it's not just one, there's like very layered, and has made a huge impact. So it was great to have it back for like 3 months so we could use the birth control that we already had stored, and our patients were able to come in, get some of those IUDs. So like that litigation really mattered, even though we haven't necessarily won long term. Any access that we can create is good access. So it's just like sitting in front of many lawyers or future lawyers, it really does make a difference when we can win or delay cases. And to be continued on if Planned Parenthood will get to participate in Title X. We are able to reapply for the next year, and we have. We don't know what that will look like, but we're optimistic. This next slide is just ways that we're also continuing to fight. We have been under attack for a long time and therefore have a lot of contingency plans. And we have expanded our services to offer a greater access to safe and affirming care like injectables, or we've expanded who can think of themselves as their patients. Like we're really focused on menopause care because we do take private insurance. And if you come and use your private insurance with us, that allows us to stay open for folks who don't have private insurance and are now having to pay really through cash. The reality is we need to win these fights with Medicaid and Title X because especially when we're talking about youth access, it is still really expensive. It's much more expensive than we want it to be when it comes to like being able to come in and especially get birth control. And it really means that if you're coming in for birth control, you're not going to pay for that extra STI testing panel, which is how we were able to like help communities keep control over like spreading sexually transmitted infection. So we also were seeing like significant boosts of our communities because folks aren't getting the testing and treatment that is when it's affordable, really easy and accessible. So I'll pass it to the next person, but like please do read the slide. There's a lot of important advocacy that is still happening, and the Medicaid, the federal law was only for 1 year. So we have the opportunity to put pressure on our lawmakers so that they don't reinstate the Medicaid defunding in the next year's budget.
I think we're going to go to Lucy next.
Hi, y'all. My name is Lucy Arbayo. I use she, her pronouns. Like it was said earlier, I am the executive director at Jane's Due Process. If we go to the next slide, for folks that have not heard of Jane's Due Process, we are an abortion fund based in Texas. Our formal mission statement, we equip young people in Texas with the financial, logistical, and legal support they need to navigate barriers and confidentially access reproductive health care, including abortion, birth control, and parenting support, while working towards a future where all young people have what they need to thrive. A little bit beyond that, some more context. We as an organization were founded in 2001 in Texas after the promulgation of the first parental involvement laws in Texas. So as we've been talking about, young people in Texas, when abortion was a reality in the state of Texas, had to go into a judicial bypass if they did not have parental consent. Because that is not a criminal proceeding, and as folks in this room know, you're not guaranteed an attorney in that process. So many young people in Texas were navigating abortion access, that proceeding by themselves. We heard from our clients around 2012 that while they were grateful for the support and the judicial bypass proceeding, they still could not afford their abortion care once they did get the yes from the judge. So that's how we became an abortion fund. And where we are now in 2026 looks vastly different than where we were in 2001. Post-Dobbs, as folks are wildly aware, right? Abortion does not a reality in Texas. There's 2 limited medical exceptions that are incredibly hard to actually meet the standards of, and we know that there are people dying in Texas as a result of that. So what that means for our work is we're primarily helping young people travel out of state for care in states where that care is still legal. So in the states that we're, helping our young people travel to are primarily New Mexico and Colorado. So they're not having to contend with the parental involvement laws that existed in Texas prior to the fall of Roe. In addition to that, and very similar to how we expanded our work around abortion, becoming an abortion fund, we have expanded our work in how we're supporting pregnant and parenting young people. We know that, and we'll get into this in a second, like because of the landscape in Texas, so many young people are being forced to continue their pregnancy at a rate that did not exist prior to Roe. Texas has historically always had a higher teen birth rate than a lot of states in the country, and that it has increased and is now going back down again. But regardless of where the data lies, we know from our callers that a lot of young people, especially young people without parental support, are finding themselves in a position where they're in forced pregnancy and having to continue. And so we created our Empowering Young Parents program that provides doula, financial, and emotional support to young people that are continuing their pregnancy, whether that is a choice or something less than a choice. I also am somebody that had an abortion as a young person. I had a surgical abortion when I was 17 in the state of Texas, and I also self-managed an abortion in middle school. And I start with that because I think it's important that folks know that abortion seekers and abortion advocates are not two separate groups, right? There are so many people in the rooms you'll be in that are and have had abortions and bring that with them into this work. And I do think, bias obviously, but that's an important context. To be listening to abortion seekers and the folks that have had to navigate these systems in real time in order to access that care. So obviously being at James due process is a huge job for me. Love everything about it. But if we go to the next slide, we can look at what that work looks like on the ground in terms of impact by the numbers before talking about the landscape in Texas, specifically with regard to birth control and sex education. So in 2025, we have a hotline text line. That's how we facilitate our case management, but it's also how we facilitate our Repro Kit delivery service. So we provide emergency contraception, pregnancy tests, condoms to young people in rural communities, and also it just serves as a hotline where folks can ask any questions. So what is consent? What does a healthy relationship look like? Where's my nearest Title X clinic? What contraception methods are best for me? All of those questions we can answer on our hotline for Texas teens. We fielded 2,703 hotline calls, 3,806 text line texts, 5,709 Repro kits were delivered. We had 63 cases of teens traveling out of state for care, which we ran the numbers on, and the total miles of our clients served in Texas in 2025 equals the equivalent of traveling around the earth 10 times. And that just speaks to the hundreds of miles that young people are having to travel in order to access care away from their communities and people who they rely on for support. We also distributed over $15,000 of infant care supplies in our community and over $188,000 in practical and logistical support. So when we support our clients, that means we're paying for the procedure, but also all of the practical support that goes around that. So their meals, airfare, lodging, mental health support, all of those things are covered by James due process. On the next slide, why this is so important in a state like Texas and the landscape we're up against. We are the only abortion fund in the country that exclusively focuses on serving young people. And the reason for that is because we are wildly aware of the barriers that are specific to young people when we talk about accessing reproductive health care. And in Texas, again, I'm biased, but I do think our young folks in Texas are subjected to the most extreme barriers that young people in this country face. And a lot of that is because of the decision in DeAndre versus Christine. So I won't get into the abortion context here because we had a panel that did a phenomenal job at really covering what those barriers look like for young people. But surprising no one, we have a total ban, a trigger ban, a pre-Roe statute, bounty hunt provisions, which are specific to Texas, and then a specific targeting of medication abortion. And then for contraception, so young people in Texas teens are the only teens in the country that cannot access birth control without parental consent at a Title X clinic. That is the result of a Fifth Circuit decision in the case DeAndre versus Becerra, where, similar to the things that we discussed in a previous panel, we had a father that very much weaponized his religious beliefs in a hypothetical circumstance or set of facts to dictate public policy for an entire state. So we had a father arguing that even the theoretical possibility that his daughter could access contraception at a Title X clinic, she had never gone to a Title X clinic or tried to access that contraception, but the hypothetical enough alone was enough to limit that access for every teen in Texas. So that is specific to prescription birth control at a Title X clinic. So that does not extend to Plan B. It doesn't extend to O-pill. But of course, and as you can imagine, if you are 16 and terrified, that nuance often gets lost among young people. So Those are the kinds of questions we saw after the Fit for decision drop a spike in calls on hotline. Those are the kinds of questions we're helping young people navigate of what birth control can I access? I don't have a parent support, I'm scared, am I gonna get in trouble? Where can I do this? We hear those kind of questions all the time from the young people that call in, and this can be confusing even for advocates that do this work day to day, get paid to do this work. And it's often, especially if they don't have a supportive parent in the home, is something that they're having to navigate by themselves. If they can't find, and it's becoming increasingly difficult, a trusted person in their school or in their community, they can go to for that information. Sex education is not much better in Texas. It's opt-in for students in schools. The curriculum has to emphasize abstinence. We're no longer abstinence only, but it is abstinence first. And then if they are utilizing the Department of State and Health Services Texas curriculum, it specifically denounces quote unquote homosexuality. So that is embedded even in the sex education that folks receive, as you can imagine. Even the education that folks are receiving in these limited circumstances is wholly deficient. And none of that speaks to the intersectional barriers in Texas. I won't have time in this panel to really dig in too deep, but folks may have seen a thread that has been true since Trump's first administration of targeting of pregnant minors in ORR, or the Office of Refugee Resettlement custody in Texas being right now moved into one specific detention facility. But that's not new. Trump in his first administration targeted unaccompanied minors in ORR custody, and that is what happened in Garza versus US, which essentially, long story short, this administration is trying to prevent unaccompanied minors in ORR custody from accessing reproductive health care, including abortion and birth control. Limits on gender affirming care, again, I won't get too into because I know the next panel is getting on that, but especially in Texas, the lawmakers that are anti-abortion, anti-immigrant are also attacking our trans youth in Texas, and so these are incredibly intersectional fights, both for our community, but also at a policy level of the tactics that they're using, and then our attacks on public education. So we mentioned in a panel earlier, Prop 15 in Texas, which passed last November, so that's just an additional layer of limiting young people's access to information in public education systems, and the weaponization of parental rights in Texas. So I say all of this not because I expect any of you to be experts in Texas, right? I mention this to paint the picture of the reality of what it means to be a young person in Texas attempting to access reproductive health care. These are the hoops and hoops and hoops that every young person that is trying to navigate this and keep their own best interest and health in mind, these are the barriers that they're facing. And what that looks like, or what I want to share with folks in practice, is a story from one of our previous clients and now current youth policy and organizing manager, H.K. Gray. They gave me permission to share their story with folks today. And I'm honored to share on her behalf. In 2017, I was a brand new teen mom and had found myself pregnant again. Months prior, I was unable to get the birth control that both my doctor and I agreed was the best fit for me because I was a de facto orphan who couldn't get written parental consent. I knew I wanted to have an abortion, and I went through a lengthy judicial bypass process with the help of JDP in order to finally be able to consent to my own procedure. After all of that, I didn't even have half of what it cost to have an abortion. The longer the judicial bypass took, the more expensive my procedure became, and by the end of it all, I didn't have enough money saved to afford an abortion. If it wasn't for JDP and T-Fund, one of our incredible partner funds, coming together to pay for it, I would have been forced to carry that pregnancy to term. This would have drastically reduced the quality of life I was providing for my daughter and brought us under the poverty line all before I reached the age of 18. I should have had access to birth control and abortion care, but instead they left me to figure it out on my own. And we talked about what preconceived notions exist for abortion seekers that are young, and in Texas it looks like the non-recognition that many of our clients are already parents. So a lot of the times in Texas, you're told you have full control over your child's body, but not your own. So although you can control the healthcare decisions for your child, you can't access birth control by yourself without your parents' consent, and you can't consent to your own care that doesn't directly involve your pregnancy care. And so that is the hypocritical landscape that young people in Texas often find themselves in, and the stories that really get lost when we're talking about what does it mean to be a young person and needing abortion access. I know that sounds bleak, but there are, I say often that like they can pry this work from my cold dead hands. None of the abortion funds in Texas are going anywhere, and regardless of what any state or federal government does, we're going to continue to be here to make sure that young people or any person in Texas can access the abortion care they need by whatever means necessary. And then my final slide just kind of gets into, recognizing that is a little bleak. Like next steps, like what are some possible solutions and things like that. We know we did a survey with Penta from 2024 to 2025 that found that while many Texas teens need reproductive health care, they don't know where to go and avoid asking for help. Shocking nobody, 68% cited shame or embarrassment. 56% worried about privacy, 40% didn't want their parents to know, 6% didn't know where to go, and 31% feared getting in trouble. So we know one of the primary barriers to accessing reproductive health care, whether that's abortion, birth control, STI testing, or treatment, is stigma. And so at James Due Process, in addition to being, policy advocacy organization, abortion fund, we're in the business of changing hearts and minds and the ideas that create that stigma in the first place. So for us, that looks like centering the stories and experiences of young people. We have a storyteller summer camp that we do that prepares folks for the next legislative session, so that when our legislators are, creating these harmful policies and bills, they're having to look the young folks in the eye that they will be directly targeting. And hearing for them about the harm that this is going to cause in their lives and the harm that it's already caused. So again, we're not going anywhere. Also support your local abortion fund of Ohio. We work really closely with them. Lexi is phenomenal. Morgan is amazing. If you haven't connected with them before, absolutely continue to support your local abortion fund.
All right, well, my name's Allison, and I use she, her pronouns. Nice to see you having us. So I'm going to talk a little bit about sex education. So I work for SECUS, which stands for the Sexuality Information Education Council of the United States. Now you know why we go by SECUS. And we really do believe that sex education leads to social change. So we've been around for more than 60 years. Our primary issue is advancing sex education policy. So we work nationally, both at the federal level and at the state level, pushing for policy that is advancing more comprehensive sex education. We work really closely with, even in this administration, we're working very closely with our friends in the Division of Adolescent School Health. We work very closely with, our Congress folks and things like that. So we have been successful in introducing a piece of legislation just last year in May, which is called the Real Education and Access for Healthy Youth Act. And we are no strangers to fighting back against the opposition, have been doing it for years. Sex education is often one of the first things that the opposition tries to erode. And I'll talk a little bit more about that as we get into things. But that's who SECUS is. Next slide, please. So before this is not I don't want you to raise your hand or anything, but I do want you to think through your own life and your own experience and what you received as sex education or what you didn't get as sex education. And then just to think through how that has impacted your life, the decisions you've made about your healthcare, the decisions you've made about where you live, how you operate. So the point of this is really to illustrate that sex education is necessary and critical to every single person. This is how we know about our bodies. This is how we can make healthy decisions for ourselves. So it's interesting that we find ourselves in a place where we're still fighting to access this information. Next slide. So when I'm talking about sex education, or when I say the words comprehensive sex education, what I'm talking about is a K through 12 framework, which is built on a scaffolding approach, right? So when you teach math, you teach the numbers first. People recognize what the numbers are. Then you know that they have to go in a certain order. Then you do addition. Then you throw in multiplication. You don't just drop somebody into a calculus class and say, figure it out. But that's what we do when we come to being sexually active or when we think about our sexuality. Of course, I mean, anything that's medically accurate, includes information about contraception and abstinence. It's inclusive and respectful. It takes in different cultural and historical realities, and it is empowering. It's also based on 30 years of research. So we know that sex education, when it's offered in this way, is really, really helpful to people. It increases mental health outcomes, it reduces physical and sexual violence. It is something that increases academic excellence. So lots and lots of really positive impacts from sex education. And so despite all of this, despite the research, we're still in a place where not a lot of people are getting really good sex education. Next slide. Oh, this was the slide that was supposed to be up. You can go over the next one. I have switched to size my own computer, but not up there. I apologize. So for federal education policy, as you know, there's not a lot. There is policy out there, but really education policy is largely left to the states. So at the federal level, we do have two funding streams: the Personal Responsibility Education Program, which is called PrEP, which is not to be confused with the prevention method. But then we also have the Teen Pregnancy Prevention Program, which is a newer program started in the Obama administration. And those two programs exist. They are doled out in different ways. They're appropriated in different ways, but they have all been under attack since the second administration. I don't know if people remember, in the first administration, there was an attack and all of the teen pregnancy prevention funds were pulled back. I was actually at Planned Parenthood at this point, and we all lost our funding. There was a major lawsuit which Planned Parenthood won, and that funding was reinstated. And that was simple contractual law. So when we were coming into this next administration, we really knew that they were going to be more creative because they'd already lost, right? So they had to figure out, how can we pull this money back? And that gosh darn DEI executive order was how a lot of it happened. So, going to their grantees and saying, hey, you can't talk about LGBTQ people, you can't talk about all of these things, and you need to submit your curriculum for reevaluation. And unfortunately, that funding stream had started under the Biden administration. It's a 5-year funding stream, and during the Biden administration, we as advocates had fought really hard to put DEI at the forefront of that funding stream. So it was like an immediate reversal there. So because there's very little to be done at the federal level, and it's very hard to push any changes within educational policy at the federal level, we're limited to the state level. And we've been seeing battles at the state level for years and years. Long before even the first Trump administration came in, we started to see battles around sex education. So currently, 27 states and the District of Columbia require sex education of some kind. They just have a law in the books that says sex education must be taught. 36 states in the District of Columbia require HIV education. So if you were around in the 80s when HIV came out, then there was a big public health push at that point. And it was more widely accepted to prevent that. And there's a whole bunch of stigma and stuff that goes into why that was possible. But that does help at the state level because it gives sex education a foothold in the door. 39 states require schools to emphasize the importance of abstinence when sex education or HIV, STI instruction is provided. And to be clear, abstinence is great. It's a great choice for people. It's super protective, but it's not the only choice. And that by giving that as the only option, we're not preparing people for the rest of their lives. Next slide. And then 14 states require abstinence-only sex education. So when it's abstinence-only, that means contraception can't be mentioned. And if it is, it's often talked about in failure rates. So that they're only, condoms don't work all of the time. They're really bad. 23 states require instruction on condoms or contraception when sex education or HIV instruction is provided. 10 states require culturally responsive sex education and HIV, STI instruction. And there are only 5 states that require comprehensive sex education to be taught. There are 3 states that mandate it and 2 states that have if-then laws. So basically, if you're teaching sex education, then it must be comprehensive. Next slide. So we at SECUS have put together, we've been doing report cards for just the past couple of years. We've been doing state profiles for years and years. But basically, the typical players who you think would have good policies do, and those that don't. So this is what the current state of the United States looks like. So it really depends on your zip code. And I want to really be clear that even in places like California, where we have a great law on the books, there are kids who are not getting comprehensive sex education there. Because again, it goes to that local control, and school districts are making the choice to opt out of that. Even though it's illegal, no one's holding these people accountable. That's part of the problem. I also want to say that Lucy talked about intersectionality, and I think that's a really critical component. And so also on our website, you can find what are called our heat maps, which then takes different policies. So it talks about like HIV decriminalization, for example, or violence prevention. And so what has had to happen because of these fights at the state level is that we're seeing that certain states are maybe slipping in additional pieces of legislation. So maybe they have an abstinence plus something on the books, but then they've added, okay, you must teach about violence prevention, sexual violence prevention. So when we put together our report cards, we're looking at all of those types of policies and looking at then also what does their state Department of Education say, or what are their board, their standards of learning for each state, as well as do they have like a menstrual equity bill on the books, for example? Because those types of bills will, if you have free menstrual products in schools, you're kind of inherently talking and teaching about menstrual products. So those, bump you up on the report card, and others bump you down. So next slide. So sorry, Ohio, maybe this isn't a surprise to you, but their health education that covers topics, including STI prevention, is required. So students must receive health education. But when we talk about health education, we're talking about like nutrition and physical education, and sexual education maybe is a couple units, like maybe a week of education, if you're lucky, when actually you could get your whole degree on sexual health education. It must emphasize abstinence. It's not required to include instruction on sexual orientation or gender identity. It's not required to include any instruction on consent. And Ohio does require instruction on dating violence and sexual violence prevention, which mentions healthy relationships. So you're getting some of that, but not all of it. And then it definitely stigmatizes abortion. And upon written request, this is where it's confusing. And I could do a whole lecture on this myself, but upon written request of a parent or guardian, a student may be excused from receiving any or all of sex education instruction. This is referred to as an opt-out policy. Beyond that, if any education about sexuality comes up, prior parental consent must be obtained. So when we're talking about these attacks, where we're pulling out, books about LGBTQ families, for example, this is where we're putting teachers in a really, really challenging spot. And we're asking our teachers to do so much. And so now we're putting another layer of paperwork on our teachers when they're just trying to teach. And it's important to note that Ohio has no regulations requiring medically accurate information. So you have your wonderful folks from Planned Parenthood coming in potentially and doing some education, but you can also then have a crisis pregnancy center coming in and providing false information and lying to our students, which is really what the trend is that we're seeing nationally now. We've had a number of trends. You have one actually. Baby Olivia bills, things like success sequencing. These types of bills are, direct attacks against sex education, really trying to push a certain ideology on young people. And the most deceptive thing, I think, is that, these Baby Olivia bills started out saying they should be taught to pay through third graders, which when you show this video, it's like this lovely AI video that's just not realistic or real or anything. And so it really is trying to brainwash our students, because when we talk about child development and how the brain develops, we know that there's going to be an emotional response for a K through third grader that's going to look vastly different through somebody who's an older person who's able to think critically and really interpret the information and think about, is this real or not? That's it for me. I'm sorry, I think I talked too much.
No, you're doing great. First question for Lauren. Is that Baby Olivia bill and that success sequence bill still pending before our legislature?
Yes, it is.
So if you want some homework, call your legislator. Okay. So many policies affecting young people operate before pregnancy is even possible. What are the biggest barriers to contraception and reproductive care that you are seeing right now?
And I'm happy to add a piece. Misinformation is a huge issue targeting young people. A 2024 study of TikTok posts, I don't even know if they call them, I don't know. TikTok things that mention birth control, almost 50% of them were negative. And so we know there was a really concerted effort to target young people, particularly through social media, on information specifically with regard to hormonal birth control. And it's effective, unfortunately. And so it's on organizations, like the ones you see here and in the broader ReproCussions, and for other folks, just having those conversations to stop the spread of misinformation and also to put good information out there so it's spreading at the same rate. And then also, and very connected, again, it's the stigma and shame piece. Folks are scared to talk about contraception, and we knew that was only a matter of time after the fall of Roe. People think that, or some people think, right, that abortion exists in a vacuum. But the reality is the stigma and shame that we apply to abortion and that when we attack abortion, has impacts on the full spectrum of reproductive health care. And so needing to attack the stigma shame pieces by making sure we have things like comprehensive sex education in our schools, by making sure our families are equipped to have these kinds of conversations, and then making sure that we're stopping the spread of misinformation, particularly on social media sites that have high concentrations of young people.
Access to a provider to get a prescription for contraception, and then being able to take that prescription to a pharmacy and actually get it filled. One asked, because misinformation is impacting this a lot. There was a brand recognition and a comfortability with going to Planned Parenthood for privacy and for contraception, and the misinformation has definitely impacted that. There's also the closures of Planned Parenthoods, but also there hasn't been an investment in other healthcare providers to be able to take on the patients that we were seeing. So a lot of folks are going without access. And then if you can get access to a provider, then the affordability of being able to actually pay for it if you don't have access to Medicaid anymore, or Title X isn't available.
Kind of related to that, Lucy, you mentioned Opill in your discussion of the Deandra versus Becerra case. Can you, for the folks in the audience who may not be familiar with Opill, explain what that is?
Yeah, so Opill is the first FDA-approved over-the-counter hormonal contraception. And so it is available, should be available in all of the same places that you get Plan B. And this has been a huge step both for access, but especially in Texas, where we do have that prohibition on being able to access birth control at a Title Plan clinic without parental consent. It does mean that a young person theoretically should be able to go into any pharmacy that has Plan B and get O-pill. What we have seen and we know in Texas is sometimes that's specific to pharmacists, right? Like we have pharmacists that go outside and above, what the law says and ask for things like ID or will refuse to provide that O-pill to a young person, refuse to allow them to check out. That happened to me with Plan B when I was a young person. So it does happen in Texas. You do get those folks. And there's also, again, a lot of misinformation around O-pill that we're having to contend with, and a lot of mis and distrust, which isn't wholly surprising, right? Like, especially in Black and Brown communities, we have lots of people that are very distrustful of, the medical community and being able to seek medical care. And so I do think there's this really crucial piece around O-pill, although it's like an outstanding victory and a huge tool for us in Texas around that education piece specifically that needs to be done so folks know it's safe, effective, available. And then there's also the issue of, because it's over the counter, phenomenal, insurance coverage for O-pill does not currently yet exist. And so needing to be able to fill that gap. James Due Process and our Repro Kids also distributes O-pill. So if folks are interested in receiving O-pill free of charge, us and organizations like ours do provide that service. But doing things like providing insurance coverage for over-the-counter O-pill would help to close that affordability gap too.
Awesome. We have some time for Q&A from folks in the audience. Colleen, go ahead. Oh, sorry, we have a microphone.
Thanks. I'm curious about this kind of also applies to the last panel, but I'm curious about the intersections between restrictions on abortion access and contraceptive access for young people and the motives of the adoption industry and the family policing system. Because we know that most people who are denied abortions do choose to parent the resulting children, but the anti-abortion movement, they're concerned about this decrease in birth rates, which we know is mostly coming from a decrease in birth rates among teens. The anti-abortion movement famously has a stated interest in the domestic supply of infants for adoption. So it's not too hard to draw some connections there. I think the misinformation on birth control that Lucy mentioned is also really relevant. So what happens to minors who become pregnant, either due to lack of contraceptive access and or lack of abortion access, and maybe pressured to choose adoption? Are we seeing legislation or litigation or advocacy around their ability to maintain parental rights, or around expanding or restricting the influence of adoption agencies or CPCs, which I think someone also mentioned?
Can speak a little bit to that, not totally, but we are seeing an increase in legislation at the state level to teach adoption awareness as a part, and often in the states where there's no sex education or it's only abstinence only. So really teaching adoption in a vacuum as kind of like this is your only option if you were to get pregnant. That's from the education perspective, those are hard bills to fight back against, because not against adoption, like sure, it's a great option and it's definitely an option available. But we are against the fact that that would be the only thing dictated to students. So it's a tough place for that, but
kind of related, but there, just as an example, there's a bill at this Ohio State House called the Stork Act that would provide insurance. What's the word?
Tax return.
Tax deduction. That's like my entire. I'm sorry. I'm doing too many things. A tax deduction for a fetus, and it would go. It could be used by an adoptive parent, like over the pregnant person. So you're correct that they're looking for anything to like beat that.
Hi, all, and thank you for being here. I'm entering this question with the full acknowledgement that this is something I've researched and I found very little to no conclusive information, so no sweat there. This is mostly directed towards Allison because I really value CCUS. I've really researched a lot of your existing work. Kind of wanted to name, this isn't just Ohio, but I think this is US wide that we're seeing, you know, some trends and especially uptick in homeschooling, in funding and incentivizing for charter schools. Do you have any specific research in any of your organizations or any places that you know that kind of speaks to what does sex ed look like, if at all, available for students and kids who are in those situations?
I know, that's why I said, like, if you're like. So to your first part of your question, I think we do have some research because you were talking specifically about like the opposition, right? So I don't even know how to answer this. It's because it's such a big answer. So we've been talking about the Heritage Foundation. We've been talking about like the Alliance for Family, whatever. There's now fake research, medical research that are saying that they can certify what things. And so I think that there has to be a call out to this larger piece, and there is that tie to this whole defunding public schools movement. And I'm not, if you looked on our website, you probably didn't find it because we need to, it's a mess. But we do have a paper there talking about the opposition and talking about how this has been an entry point for opposition. We also mark other flashpoints throughout recent history. And I think the COVID epidemic is another one where you started to see people who weren't really active and started to get more active in the space of privatization. So it's I don't know that I'm going to fully answer your question, but to say that yes, and there are political research associates, advocates, PRA. If you go there, there's a lot of research there about the opposition and what their, undermining attempts are, and ultimately, it's not a surprise. There is a heritage paper that just recently came out in January that talks a lot about actually sex education and how they see that as the path forward for hopefully their philosophy on the American society and seeing the public education system as an avenue for that. So I think like
yes, I think it's realistically as far as you can get there. So I appreciate that. Thank you so much.
Okay, we're gonna wrap up here pretty soon, but I think we're waiting on the code. So Becca, why don't you ask one of our questions while we wait for that code to come up?
Okay. Great. Well, I'm sorry I can't ask all of the Zoom questions to those who are submitting them, but there is one quicker question for you, Allison. This person wants to know if CCUS is working on advancing accessible and disability competent sex ed for disabled young people and adults, and if you track how many states require accessible sex ed. And they also offered, if not, they would love to connect to support.
Great, I'd love to connect. My email is amacklin at cicus.org. So that's on our radar for sure. We have done some work in space, but not a lot. There are not specific policies necessarily written in code, like in statutory code. There are some policies within districts at the district level and within the learning standards. But thank you for highlighting that because that is a